thanks everyone for joining. My name is Jo Glaviano. I'm the program manager with Aurora Health Alliance, and this is our fall quarterly community meeting. So we've got three folks speaking today with Dr. Robinson with the Aurora Wellness Community, Allison Draayer with Stride Community Health Center, and Jamie Rodriguez with Adams County Health Department. We are excited to hear about the Aurora Wellness Community, and I will let you take it away, Dr. Robinson. Thank you so much.
But I just wanted to introduce the Aurora Wellness Community. We are up and functional now. We have been open since August 22nd and seeing patients full-time. Let's see, I'm pulling up notes here. Aurora Wellness Community started as an idea of having healthcare, but also addressing social determinants of health. And so after chatting with the community members, the decision was made to address the 5 pillars of healthcare, to address 5 pillars, including healthcare, food access and security, community building, housing, and generational care. We have, as of now, myself hired another physician who came to us from Denver Health, and a nurse practitioner who is starting in November. I'm very proud to say that everyone who has signed on so far is very experienced in not only community health, but also working with different populations, and very experienced in teaching, as we are in partnership with the University School of Medicine. Dr. Colangelo and Sylvia, who will be starting soon, both have Masters of Public Health. We offer full service primary care, which includes pediatric work. Dr. Colangelo is actually certified for medical assistance for addictive medicine. Sylvia is a certified lactation specialist. She also has done a lot of work in trauma-informed mental health care. I personally bring to the table a long history of working in safety net clinics and with underserved care. I've done a lot of work with end-of-life care, palliative and hospice medicine. So we are very excited to kind of bring all of our skills to the table. We are at 1300 South Potomac Avenue, right across the street from the Medical Center of Aurora, and soon to be across the street from the Aurora Mental Health and Recovery Center, which is being built. So there's a lot of construction going on kind of in every direction for us. As of right now, we have 3 exam rooms, but we are expanding out to 20, so we are continuing to hire providers and staff. We opened 2 patients August 22nd. Since then, we have seen these statistics are as of last week accurate, a bit under 300 patients. So about 30% of the patients we're seeing have Medicaid, about 3% are self-pay, the rest are privately insured. We are the first clinic in the community practice division with the university, as far as I know, that is not capping Medicaid. So we will be open to Medicaid access. I believe 80% of the patients we've seen so far were actually in search of a new primary care provider. And a lot of those patients are patients who had Medicaid and have not been able to access a primary care provider because so many people have their panels closed. We had 10% of our patient population speaking a preferred language that was not English. And from the area codes that we were hoping to serve, which were 80010, 80011, and 80012, so far we have seen about 25% of our patient population from those area codes. So that is maybe the one thing that's lacking, is that we're not really serving the patients in the area codes of Aurora that we are most wanting to touch. And I am happy to take any questions from anyone if you have questions about Aurora Wellness Community Health Center.
Thanks, Colette. Mandy Ashley, the director of the Aurora Health Alliance. As you know, and as we met before, one of our focus areas at the Aurora Health Alliance is access to specialty care. So I was just wondering if you could touch a little bit on if a patient that comes in, I know you're just primary care right now, but what will that look like, or any highlights on how you can work together with partners around to get patients in for specialty care?
Yes. It's one of the things that we are continuing to work on. The Aurora Wellness Community is in partnership, so we are we're 501(c)(3), so we're actually a nonprofit, but we're in partnership with the University of Colorado Med School, and they do have an agreement with us that they will enroll our patients into their specialty services. An issue with that, of course, is that a lot of our patients are Medicaid or another government insurance such as Medicare or TRICARE, and there are patients who are self-pay. So we have not really addressed that issue of helping patients access specialty care a little bit more quickly if they are not privately insured, or even paying for it if they're self-pay patients. So there's access available, but it's not always easily available. One of the members who is associated with the AWC and with the medical school, her job actually right now is trying to figure out a better way to partner so that our patients have good access to specialty care. So it's an ongoing mission.
Awesome. The Aurora Health Alliance has quarterly access to specialty care meetings, so I'll be sure to plug that in this meeting's follow-up email, and get you an invite to that as well, because I think as a primary care physician, you have a unique and really important viewpoint on that issue. So thank you.
Thank you.
I do linkage to care for newly diagnosed HIV patients. Our PrEP coordinator wasn't able to be on this meeting today, so I'm standing in for her. But we saw that you guys offered PrEP and wanted to see who like a good contact was in your clinic to coordinate PrEP services, and what services you guys offer for navigating insurance concerns around PrEP.
So for right now, it's going to be me. I'm coordinating quite a few things because I was the first provider hired. I have chatted with a couple of people about financial issues surrounding PrEP, but all of our providers are happy to provide it. Again, financial issues are a different topic outside of having people who are knowledgeable and willing to provide it. But yes, we're all able and willing to provide it. And I would be very happy to chat with you more about partnership. We have a nurse on site who is mostly handling prior auths and medication access. So she'd be someone I would bring into the conversation for this.
Okay, that would be great. I might forward your information over to our PrEP coordinator then, if that's okay.
Yes.
Thank you.
Thank you.
We've had a couple of questions come in through the chat. The first is, do you accept uninsured patients? And the second was CHIP.
So we accept uninsured patients only in that we are willing to see patients who are private self-pay. And for that, there is a discount of 40% off routine services, which can still be prohibitive for a lot of people. So paying 60% of what your service fee is can still be quite a lot, but we do offer that. We, as of right now, are not accepting CHIP.
Thank you so much, Dr. Robinson, for being here and for providing this exciting news about the Aurora Wellness Community, and congratulations on the opening.
Great, thank you. Thanks everyone for your questions.
All right. So next up, we have Allison Draayer with Stride Community Health Center. And Allison, I'll let you take it away.
Hi, everyone. My name is Allison Draayer, and I'm with Stride Community Health Center, and I oversee business development and value-based care. I've been with Stride for this is my 15th year, so I've done a lot of different things during my time at Stride. But in my current role is really connecting with outside partners and just making sure that the message of Stride is getting out there. And today I'm not going to be talking about Stride overall. I'm going to be focusing on our street medicine team and talking a little bit about what they are doing in the street medicine program, and also putting in a little plug with AHA. We are doing a winter weather supplies drive for our street medicine team that they'll be sending some information out about. And I'm not sure if Sean made it on here or not, but we have it used to be called our HCOM. If you were connected with us during COVID, we had a team called Healthcare in the Communities, and it was really doing a lot of that COVID work. It's a team that I oversaw for about 3 years that focused on vaccinations and testing. And then we realized during COVID that there was a lot of desire to have people, to have accessible services on the street and at various locations, that some individuals, specifically individuals experiencing homelessness, weren't really interested in going to a brick and mortar facility. They didn't feel safe there. They didn't feel comfortable. And so me and a few of my colleagues decided to kind of start this program, and then Sean Marzan with our CEO kind of transitioned it into the program that it is today. And what it does is we actually have a physical unit, and it's an RV that has 2 exam rooms, a bathroom, a lab, and we're able to drive that to various different locations to be seen at partner locations. And they really specialize, like I said, in individuals experiencing homelessness or people at risk of homelessness. But we also partner a lot with different schools. So it's really, that partner, partnership mobile that will go to a partner, so that those that don't want to come to a Stride brick and mortar facility can get the services. So this is a 6-person team that is really RN driven. But, so we have 2 RNs that are willing to go out and, complete these services. And if they need to be seen by a provider, we have a really cool gadget called a MedPod, which will link actually to a provider that's in clinic. And it's in a briefcase. So we are able to do provider visits, but it's something that an RN is able to kind of do like the hands-on, and an MA is able to do the hands-on portion of it. And so, it's really been, so predominantly we work in Aurora because we partner with the School of Medicine on a grant. So predominant services are in the Aurora area, but then we also have some partnerships on the west side of town, and even a little bit into like Douglas County, and we partner a little bit with Adams County as well. Some cool metrics that I pulled, last quarter alone, they saw 564 people, and that's just in one quarter. So they've really done a lot of work to create connection with these individuals so that they feel safe and comfortable. The primary diagnoses that they've been seeing a lot of people for immunization needs, but also a lot of work with hypertension, and people getting access to their prescriptions. And then also for chronic pain. So we, see people that have a lot of need wound care, that they have these issues, and they're maybe not able to get to the emergency room, or not be able to be seen other places. And so they see them right then and there, which has been really great. I was actually lucky enough to go out with them a couple weeks ago. And one of the rounding that they do is actually up and down Colfax. And so they will find encampments on Colfax and meet with individuals and provide care to them right on the spot. And we also have an enrollment specialist that's there that can help enroll them into Medicaid. And, you know, if they're eligible, or get them on a sliding fee scale, if that's something that they need. But it's just a way that we can kind of build trust and build rapport with individuals that are able then to say if they want to come into a brick and mortar facility for more care, or, you know, just be able to get care outside of, you know, going to the emergency room. So this has been a really cool program. And like I said, Bobby just put in a little flyer for the winter warmth drive, where, you know, they hand out hygiene kits, they hand out, you know, different things during those cold weather months, beanies, gloves, socks, jackets. Socks are huge. People need socks to be changed so that they don't get infections in their feet. Obviously we'll take other things like hand warmers, tents, sleeping bags, bigger items. And we'll have that drop off at our Hamden and Chambers clinic, which is the clinic, like the home clinic for the street medicine team. So that's just a little bit, like I said, about our street medicine team. If you don't see us in the big stride mobile, they also do just like backpack care. So, you know, you may see them just like out on the side of the road, providing care to people. And it's been a really successful program under Sean's guidance. So I'm super thankful for the work that they do. So I'm happy to answer any questions about the street medicine team or anything stride related as well.
Thank you, Allison. While folks are thinking of their questions, I just want to mention that the winter drive, I think we're actually going to do it through the end of January. And if you have items and you can't get them to that location, to the stride location, or if you're part of an organization that you want to collect things with your organization together, an AHA staff member can come pick them up. So just wanted to put that out
Right
there.
around the corner from a local brewery. So, I mean, just my arm, I'll have to go and do that. But yeah, Joe, I'd be happy to pick things up and get them over there. I assume that when the street medicine team sees a patient, is there like an electronic medical record that is started for that person?
Yep, and Stride is actually on the UC instance of Epic.
Okay.
So they will create, you know, sometimes we're able to pull up and we share the medical record with university. So if they've been seen in the emergency room, we're able to get those records. So sometimes we, you know, we don't have to create a chart, but they are able to, yeah, we will create them a chart, and we will track their items, and then that way, if we see them, sometimes we don't see them for a little while if they've either been picked up and incarcerated, or if they decided to go, you know, to another side of town. And the other really great thing is, you know, being, you know, in various areas, sometimes we can track people as they move around the city. So yes. That was a long answer, Mandy, but yeah.
And then does Stride, is the team connected with the city of Aurora and that campus that is starting? Just always thinking about continuity of care. If the street medicine team is starting that record, if there are conversations about those being able to be shared if a person were to end up on the campus.
On which campus?
Like I shouldn't have started talking until I know I have the new city's campus memorized. Joe, you came off mute, please help.
Yeah, in the north, it's gonna be the North Aurora resource. It's being built. I think it's another year or so out.
Is it the Crown building
Yes.
off of I-70?
Yes.
Yeah.
I believe so. We've been in contact with them. I don't know the status of it, but we have been in contact with them, as well as, you know, some other stuff with, like Aurora Mental Health and All Health. So some of the things, we are working with individuals exiting incarceration. We work with the School of Medicine, with their team on that. We're really trying to partner with as many people as possible. We have a lot of really strong partnerships on the west side of town. Recovery Works being one of them, which is a really cool program, for people that need respite care that, because sometimes emergency rooms are just discharging people that are experiencing homelessness to the street. And sometimes they need a little bit extra. They can't stay in the emergency room, but they don't have anywhere to go. And so we're able to provide extra care to those individuals. We don't have a partner like that on the east side that's doing that work, but definitely be interested if somebody wants to do that. I see a couple things in the chat. So Rachel said, what services does the RV provide at schools? We can do well child checks. We do physicals. We do a lot of immunizations. We're doing immunization clinics. We have a very strong partnership with Cherry Creek and Aurora Public Schools. And we do obviously have school-based health centers in Jeffco as well. And then we also have a couple other school partnerships that we are trying to serve kiddos that maybe aren't able to get in elsewhere. Or sometimes people can get in elsewhere, but they don't want to necessarily. They like going where they feel safe, and where, and we create those partnerships. And then Karen said, is there a schedule of where the mobile team will be at? I don't know that off the top of my head. Yes, there is. They do, they have specific places that they go during the week. And I can see if Sean can kind of get me a lowdown of that. Sometimes they are, they have, like I know on Wednesdays is the day that they are going up and down Colfax. And they're trying to meet with those that are that are camping. And so, but other times it's kind of a little bit, depending on events that are happening with like schools, for instance, or community partners. We may be, a little bit, it may be a little bit different places during the week, but there are some standard days that they are standard places. And then Jen said, does Stride work closely with the harm reduction mobile unit? They are, I'm not sure what the status is of like if they've gone out specifically, but I do know that Sean has been working with the Adams County and I believe Arapahoe County harm reduction, the public health department with their harm reduction unit as well. I don't know if they've gone out. We also find that like partnering with people, like they've done a couple things with Secor with their mobile food pantry, going out with other partners that, that we can kind of spread our, spread the services that are happening at an event. Because if people are there to get food, why not, get seen if you're having an issue or you need to get a vaccine or something like that. So, and one of the cool things is like by having an enrollment person, we can do like a 1-day discount. We're able to do, some of those things for people that may not be able to get in to be seen by an enrollment specialist to get enrolled into Medicaid, and they need to be seen right now. So we can do some of those things like a 1-day discount if they can self-declare their income. So we have a little bit of flexibility. Obviously, we still need support because street medicine is not it's not cheap. It's not, sustainable on its own, because of the people that you're seeing. So we're always looking for people who want to continue to support this model of care. So, if you find any grant opportunities or something like that, like it's a super important service to be had. But again, is one of those things that is the first to kind of go away when the money dries up, which is unfortunate.
Allison, thank you so much. It's exciting to see how that model and that program has grown, and thank you for doing that great work. And Sean too. I don't know if Sean's on here, but you all are doing.
I'll pass the message along if he's not.
Yeah, it's just really amazing work, and like the whole meeting people where they're at is so valuable. So thanks for that.
Yeah, absolutely. Thanks, everyone.
I'll move us along to Jamie Rodriguez with Adams County Health Alliance. Jamie, it's all you, and I think you should be able to share your screen.
So hi, everybody. I'm Jamie Rodriguez. I'm the Regional Health Connector for Adams County. I'm hosted at the Adams County Health Department, and then I also lead the Adams County Health Alliance as part of my role. And today I'm going to talk to you a little bit about the Community Health Worker Ambassador Project that the Metro Area Health Alliances are doing. So first, the Metro Area Health Alliances. So currently it consists of Adams County Health Alliance, the Aurora Health Alliance, Healthy Jeffco Alliance, and the Douglas County Health Alliance. We did previously have Denver, but they have been put on pause until further notice. So when they come back, Denver will be part of the Metro Area Health Alliances, hopefully as well. So just some basic information about what a community health worker is. I'm sure like most of us know, but just in case, it's a frontline public health worker who is a trusted member of the community, and has a close understanding of the community that they serve. And the reason it works so well is because there's some built-in trust in between the community members and the community health worker that is oftentimes missing between agencies and the community. You might know them as promotoras, outreach workers, health navigators, patient navigators. They're all community health workers. So this is a simple graphic of how community health workers fit into the healthcare system. So they can provide all sorts of different types of services. They can work in public health departments, in hospitals, and community-based organizations. A lot of our FQHCs employ community health workers. A lot of them contract with our regional accountability entities for care coordination activities. So they really fit into the center of our systems to support all of our mutual clients. So beginning in July of 2025, some work that community health workers do will be reimbursable by Medicaid. So that's the work we're doing as Metro Area Health Alliances to support some community-based organizations in our communities. So this is a quick timeline of where HCPUF was at with the reimbursement process. So the bill was signed in 2023, and HCPUF held some listening sessions with community partners, and they submitted a state plan amendment. So there's different ways to change or make changes to Medicaid services, and the state plan amendment is how they decided to go. And then they received the state plan amendment back from the Centers for Medicare and Medicaid Services very recently. So they are now in the implementation phase. So very briefly, there are 3 buckets of community health worker services. So the first bucket is health promotion and health coaching. So they can provide information and training to members that enables them to make positive contributions to their health status, screen for health-related social needs, setting goals, creating action plans, and then providing information and/or coaching. The next bucket of services is health system navigation and resource coordination. So they can help engage, re-engage, or ensure that members follow up in primary care, routine preventative care, adhere to treatment plans, and are managing their chronic conditions. And they can also help them access covered services and other community resources that will help them promote their health and reduce barriers to care and health-related social needs. And then the last one is health education and training. So they can do some basic health education, basic health training that are consistent with established and recognized healthcare standards. So they can't go and share their personal beliefs, but they can share basic information. For example, healthy things to eat for reducing your cholesterol, things like that, things that have medical backing. So those are the 3 buckets of services that community health workers will be able to provide reimbursable services under. So that leads us to the Ambassador Project. So we have received funding from our regional accountable entities. So Colorado Access is the RAE for Adams, Arapahoe, and Douglas counties, and then Colorado Community Health Alliance for Jefferson County. We have funded 8 community-based organizations to prepare them for the Medicaid reimbursement of community health workers. The regional health connectors for Jeffco, Adams, Arapahoe, and Douglas counties are serving as the liaisons and subject matter experts for the ambassador organizations. And the Aurora Health Alliance is serving as our anchor organization and our fiscal sponsor for all the metro area health alliances and the community-based organizations we've contracted with. So we have 2 community-based organizations per health alliance, and their goal is to become ambassador organizations to reduce barriers to becoming an organization that can bill Medicaid for community health worker services. They were selected based on their intent to bill Medicaid for community health worker services through the Senate Bill 23002 and their demonstration of having barriers to being able to take advantage of the funding stream. So not currently billing Medicaid, or maybe not understanding the system of billing Medicaid, or lots of different barriers. So each organization receives funding to put 2 community health workers through the state of Colorado approved training programs and take the state assessment, which are 2 requirements in order, the state assessment is a requirement in order for community health workers to be registered providers and bill Medicaid. So these are the organizations we're contracted with. So Cuenta Conmigo and YMCA of Denver are Jeffco organizations. And then for the Colorado Access organizations, it's Families Forward Resource Center, Village Exchange, Benefits in Action, Doctors Care, Voila for Health, and Kids First Healthcare. So their activities, in general, primary activities are to increase their capacity to onboard new community health workers and understanding the new reimbursement model. So they'll support the certification of 1 to 2 community health workers and then attend monthly community of practice meetings. So for example, we've already held meetings that provided some information on the new training plans that the state has and the new assessment plans. And then this month they'll be hearing more about overall Coloradans. And so every month we'll have somebody come in and really just help them prepare better for the reimbursement. And I think that is it. Yeah. So questions?
I think it's super exciting that this work is already existing in community-based organizations, and now there's the opportunity to have it reimbursed for.
Are there community health workers in all counties in Colorado? That's a great question, Jennifer. I don't know. I would assume no, I think assumptions are bad. I don't know. I wouldn't assume so. Many communities do have community health workers, and a lot of them are informal with community-based organizations. So maybe they don't call themselves community health workers, but if you look at the work they're doing, they are absolutely community health workers. So that's why I was going to say I would assume so. But yeah, there's no formal like registry of community health workers, anything like that. And even through this process, there's going to be a lot of community health workers that don't take the state assessment and are not registered with the state, that are not getting reimbursed, but are still incredibly important, valuable members of the health system.
You're going to ask one more question off, not in the chat then. So do you think that's a gap? Like, do you feel at the state level there should be more corralling of community health workers being certified or whatever to make sure that they're being reimbursed? Like, or is it best to not corral? Sometimes it's best not to. So what are your thoughts on that?
Yeah, I think these are all personal opinions, but I think there's benefits and drawbacks to both, right? So I think the benefits are like a guaranteed funding source for agencies that employ community health workers. I know Medicaid reimbursement will not cover the entire salary and benefits of what a community health worker is worth, but at least it is not something that they'd always be chasing full funding for, or having people do volunteer work only for. But then that also severely limits some of the work that community health workers do. I can give an example in Commerce City. There's an organization of community health workers that do a lot of environmental justice work. They are out in their community, training community members on environmental justice, training them on, outreach to their elected officials, doing public information campaigns, things like that. And that stuff is not reimbursable. So their willingness and desire to participate in this program is probably zero, because it would limit their ability to do the work that they want to do, if that makes sense. So yeah, I think there's also, and then I'll let Laura go. I think there's also some distrust still, right? There's distrust between promotoras, traditional community health worker agencies, and the systems that we work within, the healthcare systems, the Medicaid system, the government system. There's still some distrust. So I think that would also severely limit desire to participate in this system as well. Go ahead, Laura.
No, I would agree with everything that Jamie has to say, and also add that I think in the coming year or so, we'll learn a lot about what this looks like for different organizations, right? As they're starting to bring this on. And so I think, I think we're just going to learn a lot, and there will be lessons that we can share with community partners, so that we can continue to build upon successes and learnings.
Thanks for your questions, Jen. As you can tell, we're very passionate about the community health workers. We were really excited to go for this opportunity as a metro area health alliances. So yeah, we're enjoying this very, very much and learning so much in the process.
Thank you, Jamie. Any other questions, comments, thoughts from folks? Or for any of our speakers? It's a lot of great information, so.
I know that there is some attendance from Children's Hospital Colorado, and they were leading the charge for Senate Bill 23002. So thank you to Children's Hospital for being out in front to advocate for that last year. Yeah.
And I wanted to, as always, thank our affiliates. And I don't know if we mention it often enough, but our affiliates are the folks who, sorry, I didn't get this in full screen, but our affiliates are the folks who really, the organizations that fund us and allow us to do the work that we do. So we want to take a moment to say thank you for that. Any community announcements that folks like to share? If you have any upcoming events or resources that you'd like us to know about, we'd love to hear them. You can also put them in the chat and we'll include them in our follow-up.
Hi everyone, Chloe with Community Medical Services here. I dropped some information in the chat, but we are opening a new outpatient opioid treatment clinic in the Del Mar neighborhood, which will open on Monday. That one will be open from 6:30 a.m. to 1:30 p.m. Monday through Friday, with some earlier hours on Saturday. We do anticipate those hours extending based on community need. Everything we offer is available on a walk-in basis, as methadone, buprenorphine products, in combination with counseling and medical. And we're really looking to glean any information from those already engaged in the community on how we can best support. So please reach out if you have any questions, any ideas of what we can do to be a good partner for the neighborhood, and we'd love to see you all there.
Great, thank you, Chloe. Julia, I saw you put a link in the chat. Could you just, I'm not sure what that's for, Community Center for Health. Is that for an event?
Yes, sure. I was just helping our friends at CU Anschutz Center for Health Equity share their community campus forum that's happening on Saturday from 8 a.m. to 2 p.m. And anybody, community organization, community member, that, lives in the area or works alongside CU Anschutz is invited. This is a first step to kind of bridging the gap between the campus and the community. I don't know if Maisha or anybody else is on board that has more information, but just thought I'd share. Thanks.
Awesome. Thanks, Julia. Dennis, I see you have your hand up, and then Jen.
Hi, all. I am on a task force to create a form that was created by law in May called Friends and Family Input Form. And we're kind of on a listening tour right now through the rest of this month and probably a little bit into November to get input from the community and from providers on how to design this form. And what it is the form means it's created to allow family and friends to provide health and background information about an individual receiving mental health or substance use services. And we are in the process of expanding that to include the physical health services for people with behavioral health issues. So input would be great. I have information about OCBN. I'm also doing podcasts in partnership with Behavioral Health Administration. So if you want to get in touch with me, I've got my email in there as well. But again, I can let you know when the next meetings are, and they're all virtual as well as some on site. So any help would be appreciated.
Great. Thanks, Dennis. Yeah, we'll include that information in our follow-up. And Jen, I see your hand up.
Yeah, I just wanted to invite everybody. So the Colorado Consortium for Prescription Drug Abuse Prevention has an annual meeting each year. It's really just like a little annual session of what's been happening this year across Colorado. And our annual meeting is going to be both in person and also online. And I know a lot of you are close to the Anschutz Medical Campus, so we'd love to see you there in person if you can. It's Thursday, October 31st, 8:30 a.m. to 3:45 p.m. The Attorney General is going to kick us off. We've got CDPHE coming to do some conversations around key trends in overdose, a SAMHSA presentation, consortium highlights, some awards. And then in the afternoon, we have a panel of peers, some state epidemiologist stuff, harm reduction services, and then peer support services and recovery in the workplace. So I'll put the information in the chat and hopefully you all can attend.
Perfect.
Thank you.
Thank you so much. Maria?
Hello, good afternoon. I just wanted to announce that Beck will be hosting a COVID-19 vaccination clinic for youth ages 12 to 18 tomorrow here at our center, 1609 Havana Street. And then we'll be providing incentives, $70 incentive to any of the youth that are vaccinated 12 to 18 years of age for COVID-19.
Awesome. Thanks, Mariette from Village Exchange Center. Thank you so much. That's great. And Rory?
Hey everyone, I'm Rory Franklin. I'm with Aurora Water. I'm the Senior Communications Strategist. And we have a free lead service line replacement program that's taking place. So it's primarily for homes that were built in 1960 or earlier. They are the ones that usually have the possibility of having a lead or galvanized steel water service line installed. So on our website, we currently have a new development, which is a person can just enter in their address and find out what kind of service line it is that they have, and then contact us if that needs to be potholed in order to have an investigation done or eventually have it replaced.
Great. Thank you so much. Appreciate that. I do want to mention, thanks, Pat, for putting the Medicare Mondays trainings are presenting at senior buildings. That's through the Colorado Gerontological Society. So thank you. It is that time of year. Open enrollment is upon us. And then the Adams County Health Alliance is hosting their quarterly community meeting on Monday, October 21st. It is virtual, and the Department of Healthcare Policy and Finance will be presenting on Cover All Coloradans. So thank you for that. Right. I want to thank our speakers, Dr. Robinson, Allison, and Jamie. Thank you all so much. Thanks everyone for being here. Please stay well, stay healthy, and we look forward to seeing you at a future Aurora Health Alliance meeting. So thanks everyone.